Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam!
And if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kanisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised. Meet Deja. She's the next badass birth warrior who will share her story to help the squad navigate through the complex and inspiring journey of pregnancy, labor, birth, and motherhood.
In this episode, we are talking about her forceps delivery. During the interview, you may notice some medical terms or jargon, but don't worry, we got you. We have included definitions and explanations in the episode description, so please listen up and enjoy her story.
Well, welcome back to another episode of the Birth Squad podcast. We have yet another special guest, someone that I have the privilege of working with on the regular on labor and delivery, one of our very best nurses, Deja McCullough. So, Deja, welcome to the Birth Squad.
Hi, thank you for having me.
We just wanted to start by asking you, can you tell us a little bit about yourself?
My name is Deja, like you said. I'm a mother of 4, 3 girls, 1 boy. I've been a nurse for 13 years.
Can you tell us a little bit about your path to motherhood as a mother of 4?
Well, I'm an only child, so I've always hated being an only child, so I knew I always wanted a lot of children. Just always wanted to be a mom. I went from high school straight through college, and then I got married, and then I wanted to start a family.
Of your 4 kids, we wanted to kind of focus on that first delivery experience. Can you talk to us about that birth? And specifically, because you had operative vaginal delivery with forceps. So can you just, if you can, walk us through that birth and walk us through what that delivery looked like?
Okay, well, that was a whole very interesting experience. I was very young, and then originally I wanted to have an unmedicated birth. So I did a lot of like reading and stuff. So I went in there. My water broke like at 2 a.m. on a Monday morning. I didn't really get contractions, so I just basically came in and I wanted all natural. I didn't want Pitocin. And at this time I was a nurse, but I wasn't a labor and delivery nurse. So I wanted to just wait till contractions came naturally and everything. And then after about 12 hours, nothing was happening. And then I had to get on Pitocin. And then eventually I needed to get an epidural. The labor was just super long. My daughter, she wasn't born until 5 a.m. Tuesday morning. So it was a very long labor. And she was also OP, sunny side up. At the time, that was my first pregnancy. I wanted to have a course of vaginal delivery because I knew that if I had a C-section with my first kid, it was toe lacking and VBACs weren't really a norm. So I was really worried that was kind of going to cap the amount of kids I could have to probably 3. So I was really, really adamant that I did not want a C-section for that reason. And I think going back that my daughter's heart rate probably was going down. And I don't really remember ever a C-section really being discussed until the very end, but I remember I signed a paper form that's consented to the operative delivery.
Deja had a unique birth experience. Only 10% of vaginal deliveries will be an operative vaginal delivery. But what exactly does that mean?
When we talk about operative vaginal delivery, we are talking about a delivery that utilizes a tool to assist with the delivery of the baby. And there are 2 ways to do that. Number 1, vacuum assisted. This is where a handheld device with a suction cup at the end is placed on the baby's head to help deliver the baby while the mom pushes. The second one is called forceps assisted. This is when a handheld device that kind of looks like two large spoons are used to cup the baby's head, and it helps deliver the baby again as the mom pushes. But what are the differences between the two?
Most providers will use one or the other based on how they were trained and feel most comfortable with. For example, a lot of providers on the West Coast were trained using vacuums, while many on the East Coast will use forceps. Another aspect is that the baby must be low enough in the pelvis for a vacuum to be used. In the case of forceps, the baby can be higher in the pelvis. However, in both cases, the baby must be below the pubic bone, and the patient must be completely dilated with adequate pain control. But who is the ideal candidate for an operative vaginal delivery?
So, there are two situations in which an operative delivery may be performed. The first one may be because of maternal exhaustion or prolonged pushing. The first thing to know is that a first time mom will, on average, push for 2 to 4 hours. That's right, y'all, 2 to 4 hours. Now, the data shows that pushing for longer than 4 hours can be associated with adverse outcomes, such as increased bleeding postpartum, fetal distress, or long term pelvic floor issues. So, when a person reaches that point, the birth provider may assess if the baby is low enough and see if an option of an operative delivery is a possibility. The second situation could be fetal distress. Sometimes during pushing, the baby becomes quite distressed, meaning that the heart rate drops below the normal range. In this situation, the baby is close to delivery, so we will offer someone an operative delivery to expedite the delivery of the baby.
It's worth mentioning that this is a conversation. You must first give your provider informed consent. Part of that process includes reviewing the risks, benefits, and alternatives. But what are those? Well, some of the risks include risk to the baby versus risk to you, and we'll review those right now. So, the main risk to the baby usually is in the form of a laceration or a cut on the head and bleeding beneath the scalp, which will be reabsorbed by the body over time. The primary risk to you is a higher degree laceration. In Samantha's story, episode 5 from season 1, we discussed the 4 types of lacerations. Operative vaginal deliveries are associated with an increased risk of 3rd or 4th degree lacerations. Now for the benefits. Number 1, avoiding a C section. Number 2, immediate delivery of the baby, especially in the setting of fetal distress. And what are the alternatives, you might ask? Well, we could proceed straight to a C section.
Now that we've clarified that, let's get back to Deja as she shares more of her experience. Please be advised that this could be triggering for those who have experienced labor or birth. We recognize and understand the significance of birth trauma. You went in with, expectations of a vaginal delivery going unmedicated, and it turned into needing Pitocin, being on an epidural.
Yeah,
So I can imagine that maybe your plan did not include the thought about an operative vaginal delivery.
exactly. Yeah.
Like, what was your understanding about it prior to your experience?
I don't think I really thought about it at all. I just kind of, just the ignorance of it all, I just thought like everything's going to be fine. So I didn't even think of that as an option. It was either, vaginal delivery or C-section for me. So when I was presented with that, I was just like, I guess it's better than a C-section. And they said it's safe. I delivered at a teaching hospital. So I think it was the attending and then a resident there.
Do you have any idea of how you felt? Like, was there any overriding feeling that you remember in that moment?
Yeah, at that point, I was really, really exhausted. I had been up for probably like 2 days. So I don't remember everything verbatim. I had a lot of people in the room. So I was kind of happy to have like an end to this whole
Hmm.
whole ordeal.
Who was in the room,
And
if you mind me asking, that you didn't
then
want?
it was pretty much like everyone except my husband. It was my mom. It was my husband's mother. My best friend was there, but she was fine. She actually was great, and then my husband.
So just extra support people that maybe didn't make it a supportive situation.
It would have been. I think the energy would have been different with less people.
Yeah, Deja, I feel like you also brought up a really good point, and that's exactly why we wanted to have this conversation with you, is that most people, when they think about their delivery, they're only thinking about C-section or vaginal delivery. There is
I'm sorry.
actually a third option, like you said, that can help
Mhm.
prevent someone from having a C-section if they are a good candidate for it, which is an operative delivery. So, like, I know this was something that you didn't necessarily prepare for mentally, but like, were there any concerns or fears that you had about the procedure? And then, like, how in that moment did you like mentally and emotionally kind of like prepare yourself for that?
Um, like I said, I was exhausted, and then actually talking to you guys now, I remember I was also pushing for 4 hours too. So it was a long. I was just like I said, glad to have an out, and I was I was nervous, so I had like a lot of anxiety. I was pretty just nervous that it would affect my baby. I didn't really hear too many cons with it affecting the baby, so they just said I could tear more. So I was just nervous and didn't know what to expect.
So, can you walk us through the actual procedure and what was that experience like for you?
I think my epidural wasn't working properly, so they gave me a bolus maybe like 20 minutes before, I believe. And then there was so many people in the room, like tons of people. I think they timed when the forceps were placed. I think they did like two tugs, but it was like with the contractions, like so maybe two contractions, then she was out.
Good. So it seems like you were able to avoid a C-section
Yes.
and relieve the length of your labor. Were there any unexpected challenges or complications that occurred for you?
Yes, definitely postpartum for the birth. My daughter had just some redness on her forehead, but that went away by the time we left the hospital about two days later. And then I don't remember the degree of the laceration, but I know it might have been like third degree. So leaving, it became infected, and then I went to their hospital, and they were able to repair it, and I had to be on antibiotics. So it was this whole the repair was like pretty much the worst part of it. Trying to navigate motherhood, that was a hard time.
It sounds very difficult. How did that make you feel emotionally? Probably a redundant question, right? But like when you look back on that time, how did you feel?
It was difficult because I didn't like just no one. I didn't have a lot of support from my family. It was just my husband and his mom trying to help me. Like I just kind of had to navigate it myself, and so I knew it was infected. But then I was like, is it a big deal? And it was rough. And then still trying to like breastfeed, and it was a lot.
Deja had such a difficult birthing and postpartum experience.
Part of that was due to her laceration getting infected. But is that common?
Well, when you have a third or fourth degree tear, we worry about two things. Number one is a breakdown of your repair, and number two is infection. Often, your provider will schedule you for a sooner postpartum visit around 2 to 3 weeks after delivery to check your laceration and make sure you don't have one of those complications.
One important thing to keep in mind about postpartum is constipation. Ask anyone who has given birth. That first BM can be a hard situation, pun intended. But in all seriousness, straining can lead to excessive pressure on the laceration or even on a C section incision, which can then increase your risk of wound breakdown. Using medicines such as fiber or stool softeners are recommended to help prevent constipation.
But ultimately, Deja needed a squad to help her. So we hope hearing her story motivates you to build one. Let's hear what pearls Deja wants to lead us with.
Is there any advice that you want to offer to expectant mothers who may be facing the possibility of an operative vaginal delivery, or any other advice that you would like to share for women postpartum?
I would say definitely do your research, look into every single option there is, not just the ones that are most popular, or don't just go with like what you plan to do. Definitely look into every single option, know the risk associated with it, but also the benefits.
So after you had that experience, you had 3 more kids,
Yes.
vaginally, I assume?
Yes.
How did your first experience affect your decision going into your second birth?
My second one, it was different. My water didn't break before labor. They were all four were completely different. My second one, she was like a week overdue, which now I wouldn't go that far, but then I just needed a little pitocin, and I pushed maybe for 30 minutes. And then my third one, my son, he was also OP, and I pushed for another 4 hours. But I was asking for a C-section with him, but the doctor said no. Like, I was making progress. She was right. And then my last baby, she just turned 3. I was induced because my blood pressure was high, and I just needed a little pitocin, and I went from 4 to complete in like 20 minutes, and the doctor barely made it. So all very different deliveries.
But at the end of the day, would you say you would make the same choice as far as your first delivery is concerned?
Yes.
And I would say, you had the right mindset, right? You're like, I want to have a lot of kids. A lot of people, that is their thought process, because I know A, I'm going to go with B, right? Like that I think that makes a lot of sense.
Yeah.
Given that you have 4 kids, because a fourth C-section would have been quite challenging
Oh no.
potentially,
Yes.
and so we'd be having a whole nother conversation.
Is there anything that you wanted to share with the Birth Squad or anybody else who might be listening to the podcast?
I just say to, and we all have our plans, but to just kind of go with the flow. Don't be too hard on yourself if things don't go as planned. I know I kind of was upset that I ended up getting an epidural, but I mean, now it just doesn't matter. The whole point is healthy mom, healthy baby. So just be kind to yourself.
Great advice. Yes.
Well, thank you so much for coming on the podcast. We really appreciate it. We love hearing unique stories. Um, and we love just sharing more information with our listeners, because there's probably someone else out there who had the exact same experience as you and might really resonate with your story. So thank you. And
Thank you for having me.
That's the wrap of this episode of The Birth Squad.
thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts of your experience. And we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad, and check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Okwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from The Birth Squad.